Hi everyone. The most common doubt as a patient who has lost few or all his teeth would be, shall I go in for a implant or shall I go in for a denture? Are implants better than denture? This is the most common doubt which as a patient you might be having. Herein, I am here to clear your doubts. My take here would be definitely implants are always better than denture. There are few pros and cons which I'll be speaking on. So if we talk about dental implants, the dentition or the teeth which we give by means of dental implants are fixed in your jaws. So practically the implants are fixed in your jaws and the teeth or the crown is given over the implant. So herein you need not remove your teeth and wash it regularly, etc. As in the case of denture, you will be removing the denture out of your mouth and you will be washing it repeatedly, maintaining it and all that. So the first difference would be the dentition of the teeth which we give through implants are fixed in your jaws, wherein the denture is the removable component, wherein you'll have to remove each time for maintenance, for cleaning and all that. That is the first thing. The second important point, if you are a patient who is going to undergo either one of the treatment, be it implant or denture, the main problem which a denture wearer usually faces is like during the time of chewing the food. I mean during eating, drinking water, say going for a social gathering or being among your friends and all that. So let us take one by one. During chewing, usually the denture wearer who has a removable denture always complains of ill-fitting dentures, like it's loose, it comes out of my mouth during drinking water, it comes out of my mouth while I talk quite fast, when the tongue movements are pretty more, etc. So these problems are avoided in the case of dental implants because it's fixed in your jaw and it is secured, so it doesn't remove. And usually the removable denture wearers, the main complaint is social embarrassment. Being a removable denture wearer, say they go in for a meeting or say for a social get together or a wedding function, anything, let it be anything. So there have been instances where my patients have complained to me, like during speaking or during eating, the denture has come out of their mouth. So which is very embarrassing for the particular individual. These kind of situations can be avoided by giving dental implants. And the final and foremost important thing would be the implants are fixed in your jaws. So it prevents resorption of your bone. So what is resorption? The bone, the jawbone, the lower and the upper jawbone, once you are devoid of your tooth, you lose your tooth for some reasons, like let it be dental caries or loose tooth, or you met with the accident, or let it be any reason. Once the tooth is out of the jawbone, it is by nature that your bone resorbs. So, and on top of this, if you are planning to wear a removable denture, the resorption rate of your bone increases manifold, many times. It increases many times. So your existing bone reduces further. That is called resorption. So if you are a patient, if you are undergoing dental implants treatment, the resorption of your jawbone is definitely prevented. Wherein in the case of denture wearers, I have seen patients of say 10 years or even more who comes in for dental implant treatment after wearing the dentures for 10 years. Practically they are left with no bone because they have been wearing the denture for 10 years. Their bone height reduces drastically due to resorption. These things can be prevented by replacing the tooth using dental implants. So what are the drawbacks of the removable dentures? As I already spoke, The first would be resorption of your bone. Once you start wearing removable denture, it rests directly on your bone and it causes resorption. The thickness of your bone keeps reducing drastically, and even if you are planning for replacing a tooth with dental implants, say after 5 or 6 years or 7 years or 10 years, you will be left with very little bone. Keep in mind. Then what would be the other negatives? What would be the other negatives as a denture wearer? You will have to remove it frequently for maintenance, for cleaning. It can get lost. You might end up doing another denture. There are patients for me who has two set of dentures. Because previously they must have met with a situation of losing their denture in some important function or something and facing embarrassing situation. So there are patients who has two sets of dentures, which these things can be avoided if you are planning to undergo teeth replacement by using dental implant. And the final thing would be breakages. The denture can get broken into two halves. Again, you will have to fabricate a new denture. These are the pitfalls and disadvantages of being a removable denture wearer. So my final take would be dental implants are always better than the traditional removable dentures. Thank you. See you again in another interesting topic. Bye.